Hi, this is Robert Yoho, and this is the Surviving Healthcare Podcast. And I have Cindy here, who's a breast cancer survivor, and she is going to tell about how she beat breast cancer. But before we start, we're all on first name basis here. Cindy and I are friends, and on first name basis, Robert and Cindy. And the disclaimer, of course, as always, is that this is not healthcare advice. If you have medical problems, see your doctor and use this information at your own risk. So, Cindy, take it away and tell us about your story.
Yes. Well, I had a very healthy childhood growing up, and then 9 months after marriage, we discovered I had Hodgkin's lymphoma, stage 2A. It was above the diaphragm, so I underwent 6 weeks of radiation and had some different complications, but I basically had, good health between 1985 until 2014, when we discovered I had breast cancer stage. Well, they never really staged it, but it was early. I'm not sure. Anyway, and the regular medical community they put this, I felt like it was like a car sales offer. They said, we can offer you a double mastectomy, and that would be it. Because of my history of having Hodgkin's, they said if they just did one breast, it might come back in the other breast. So they said I should have two. So I declined that offer. I thought it was so strange. It was, anyway, to put it like an offer.
They get paid a little more for two.
Yeah.
Yeah.
So, pardon?
They get paid a little more for two than.
Yes, and they were promoting, well, look, Angelina Jolie did it, so, why not? I mean, it's like the thing to do now, do that and then get implants. So anyway, I didn't want to do that, but that doctor was nice enough to follow me with blood work, and I did scans, and I was trying to treat it myself with juicing and things and different supplements, and finally it was growing, and so we were in San Diego, and I was trying to find an alternative doctor, and I found one who did embolization. They went in with a catheter and embolized the tumor, veins veins, I think they are called, and to seal off the tumor so that it couldn't get blood supply. That's the point of it, to kill it. Then 2 weeks later, I went in for cryoablation. They froze it, what was remaining, because she said that often tumors grow back, they create new blood vessels, and blood vessels, that's the word. Anyway, so I did that. I had some different complications of that, but I returned. I lost mobility temporarily. I had I had a thoracic stroke, which caused a lack of mobility, but anyway, through rehab, I gained my mobility again, but it was very scary at the time. Then I had a PET scan, everything was clear. Then 15 months later, that was when I woke up one morning and I could only shuffle around. My mobility, I was walking with shuffling like Tim Conway on the Carol Burnett show. And I knew something was wrong, plus I had lost feeling from the pelvis down, more feeling. I already had lost previously feeling there, but it had increased. So I went to emergency, and we were shocked to find out that my breast cancer had metastasized, and so I was considered, and still am considered, stage 4. It was in the spine, and the reason for the loss of mobility was because a tumor had broken one of my vertebrae, and that's why I lost mobility. So the doctor put that vertebrae is gone. I have a gap in my back, but anyway, he put a rod and 8 screws in my back, and I went from, it's a miracle. I mean, tons of blood loss. There was so much blood that the nurse was worried that I wasn't going to make it. They couldn't seem to stop my bleeding. The tumor was bleeding profusely. I mean, I guess the whole operating room was lots of blood. Then they used gel foam and were able to stop it. But I just read these notes recently, and I didn't realize how I was hanging on so barely, back in 2020, December. Anyway, so he did a great job of surgery. So then I went from a walker, had a back brace, and was using a walker up until March. I was referred to a doctor. Dr.
Glazer. Yeah.
Okay,
And this
Dr.
is where
Glazer.
this is where the story gets interesting.
Yes.
I think if you had been to Dr. Glazer at the start of this whole experience, you would have prevented all this. And by that
Yes.
point, your weight was down to what?
Well, I already was light even before going into the hospital. I was like 102 because I had lost my muscle mass, hadn't been working out, and so I was very light even before. So then I went down to like 94 in the hospital because I lost weight in the hospital and through everything. But anyway, it was 102 by the time I visited.
So Dr.
No, I wasn't.
That's a tough period. Dr. Glazer has published her successful experience treating breast cancer using implantable testosterone pellets. And she also uses an estrogen blocker drug with that. Were you given that estrogen blocker before?
Yes, let's see. The whole thing started because I went to an oncologist previous to December because I had gone to a doctor and that doctor wasn't a cancer doctor, and they said, "Oh, we can't treat you we can't treat you for cancer. You need to see an oncologist." I wasn't going to them for cancer; it was for thyroid or something, or just checking checking in a different way than traditional doctors check. Anyway, so that was what got me going to an oncologist. That oncologist did blood work, and I saw that blood work, and my tumor markers were really high, like 70, and then I knew something was wrong, and that's when then I found out then like a week later, I found out that I had to be hospitalized and found out that my
metastases. So,
yeah.
But that doctor was talking about, or at least tried to put you on an anastrozole or one of the estrogen
You're right.
blockers.
Okay, so I forgot. Yes. So anyway, when she found out, so then it really encouraged me. I hadn't seen any other doctors, and I didn't really want to do chemotherapy and all that stuff. But she, had to do something, I guess. She offered me, I think it's Breva or something. It's something that they traditionally give people in my situation, stage 4. But I didn't take that. I never did take it. And then the minimal thing I did was, I think it was letrozole. And then when I went to see Dr. Glazer, she continued she had me, and we met, and she had started me on testosterone, which already, pellets, which had the anastrozole in them to begin with. And so.
Yeah, those make you feel terrible because your estrogen goes to zero. But they're the traditional treatment for breast cancer, and they seem to help. But this therapy that you had is probably much better. And I wrote about it in my book, Hormone Secrets. I have no experience with this, but I've read about it, and there are references about this in Hormone Secrets. So go ahead. And so Dr. Glazer got you on the
pellets.
The testosterone pellets combined with the blockers. And
yes.
You had a good reaction to that, didn't you?
Yes, and I was, as we said, I was on the blockers already through my other doctor, and the main thing for me is immediately hair loss. So I lost about a third of my hair. I have quite a bit of hair, so that's helpful, but still, it was thinner, even thinner. So then it continued to lose hair, not as much as the beginning. But anyway, that was the main side effect that I noticed from the blockers. But anyway, I met with Glazer in March 29th. I remember flying out there, and
she's in Ohio, and her website is hormonebalance.org. Hormonebalance.org.
And I went out there with a cane. I had been using the walker, but I decided to use the cane. I had graduated from the walker to the cane. Anyway, each visit, I would visit her every 3 months. And the final visit, so I visited her 3 times. Final visit, I didn't use a walker or a cane. And she
gained
was
some
very
weight
happy.
too. You gained some weight too.
I gained some weight, yes. I went from like 94 to 109.
That's fantastic.
So, and then I started working out in July, because so I had the energy and strength. I started my muscles. I got stronger because I used all the different weight machines and just got stronger and stronger. Had energy and kept improving mobility wise and energy wise.
So Dr. Glazer apparently attempts to get the testosterone levels in your blood up to low normal for a man. But you didn't seem to have side effects from that. You didn't have any acne or hair growth, did you?
I didn't notice any with that testosterone level. Correct. Mm-hmm.
And so you were doing very well, but it was inconvenient to go all the way to Ohio. And
yes.
Dr. Glazer encouraged you to find a local doctor who could set you up with testosterone and so on. And so you ended up seeing Dr. Rosier, right?
Yes.
And what was your experience like over there?
Oh, that was great. I visited him in December of 21, and he said I do not need to take the hormone blocker, so I was glad about that. My hair's been growing back. I've got 5 inches of new hair growth. He has me on a bunch of different hormones.
Your tumor markers have improved by now.
I forgot to talk about that at all. Yeah, the big change with starting even with Glazer, with the testosterone, my tumor markers, I have to get that. I should have that handy.
It's okay. We don't know the exact numbers, but they're much better.
They went from 70 down to the normal that the normal traditional doctors accept as quote normal is 35. This is for the 2729 tumor marker test. Normal is they accept anything 35 or less, and mine were originally 70, and then they're down to like 11. So they're way below normal.
That's fantastic.
And they just kept dropping each time. Every 3 months, they would drop, or every time I got new blood work, they would go down more. All the tumor marker tests that are possible, like 15-3 and CEA.
Fantastic. And so you're now on standard doses of estrogen and you're on estrogen and progesterone.
Yes, and testosterone.
And testosterone, you're on a higher level, which gives you blood levels of, what does he aim for, around 800 or 1,000?
It's 1,500. I don't know what the blood level, but that is what I'm taking is 1,500 blood work. I don't know but anyway, he knows I'm on the right.
Yep.
He looked at my blood work and he said, yes, you're right where you should be. And, so that's what we're doing.
You understand why this drug is not used for breast cancer, don't you? It's not patented, and it's too cheap, and Big Pharma can't make money on it.
Yeah, and the doctors are just told, like my doctor, my oncologist, she said, that's just, they tried that a long time ago. Doesn't work or whatever.
Before they invented all those patented blockers, which are enormously expensive, they used testosterone with great success.
Yeah, so everything improved. I had lots of different issues. They're all gone. I had lung clot. I had water in my lungs. They had to be drained. All these things are gone now. The other things that have happened is originally the cancer was in my hips, my sternum, my spine, and my breast. Original tumor was in the right breast. That original tumor is gone. The cancer in my hips is gone. I'm going to get a scan in a couple of weeks, but last scan I still had some remaining in the sternum. The tumors in my spine, I did have 5 days of radiation treatment back in January of 21. And so those tumors, there's no change in them. They're considered treated and inactive is what they said. And so those are all good, positive things resulting from the testosterone as well.
That's freaking incredible. I mean, it's an enormous improvement.
Yes.
This is just one story, but Glazer and some other people that I wrote about in Hormone Secrets have other stories, and it'll never be formally studied because you can't patent bioidentical hormones and make enormous profits on them. It is now standard to do hormone therapy for breast cancer survivors, and we have over 50 published studies confirming that they live longer. But the mainstream recommendation is to wait 5 years after diagnosis before starting treatment. And some sources say to only wait year if there's no tumor extension beyond the capsule of the armpit lymph nodes. But there are studies that have shown double the breast cancer recurrence rate in women who are left untreated. So your problem seems to have been more a hormone deficiency than the cancer. I mean, it seems like you've tuned up with the hormone supplementation.
Yeah, I guess. And then I was going to say my particular breast cancer was hormone-sensitive cancer, breast cancer, whereas other, there's different types of breast cancer. I've had a friend who she said hers was not hormone.
So to interject,
so mine,
to tell the audience what that means that estrogen blockers are supposed to work, yet you were taken off your estrogen blocker. So paradoxically, getting on normal levels of progesterone and estrogen, and then getting a supernormal level of testosterone did the trick for you. And so the message is there are many treatments for cancer and many things that aren't offered because they're not profitable for the doctors and for the system.
Right. Yeah. I mean, this is totally, if you have hormone sensitive cancer, breast cancer, excuse me, I had a cough. If you have hormone sensitive, then I forgot what I was going to say.
In theory, you're responsive to the blocker that you took and you had so many health problems with. In theory, the blockers are the best treatment, but in actual practical fact, testosterone is probably a better treatment for most breast cancers.
Yeah, what I was trying to say was the traditional doctors want to take you off hormones. They think hormones are the problem, whereas alternative doctors have found that a hormone-sensitive cancer responds well to adjusting your hormones, and giving a super amount, like we've talked,
super
high doses of the
testosterone. Yeah. So you and your side effects are modest. I mean, you feel better, you're able to function better, and you haven't had a lot of hair or acne. Those are the ones that people complain about.
Right. I mean, I'm very fair, so luckily the hair, I do have a little extra hair, but it's easy to take care of it. But it's not like you're growing a beard or something.
Really?
It's manageable. I can manage it. I'm very fair, so. Yes, it does promote hair growth and other side effects which people can read about, but they're acceptable, or they're tolerable, because it's keeping my health good in other ways. So
it beats the heck out of walking around with a walker and having your bones collapse
I live a pretty normal life. I mean, I still continue doing what I do, exercise and enjoy life, cooking, shopping. And,
so you're about my age. You're in the mid-60s?
I'm 66.
Yeah, I'm 68.
I'll be 67 in September.
Don't you love it? I never thought I'd be 66 or 67 or 68.
We never, when you're younger, everybody seems old. When you're like 19, a 21-year-old seems very old. But when as you age, I've found that you don't feel you're young, because as soon as you hit that age, this is not so old,
It's crazy.
If you feel good, if you have good health,
Well, congratulations on how well you've done, and we don't know what the future holds for any of us, but we're going to be as courageous as we can and continue on, and hopefully this will get the message out there to some other people with breast cancers to consider seeing a hormone doctor and looking at
especially if they have hormone sensitive cancers.
Well, paradoxically, what that means is that you're supposed to take anastrozole and other blockers, and you got off that stuff and you actually did better. So I'm not sure what to recommend in that regard.
I'm saying if women have, or men or women have hormone sensitive cancers, they should check out alternative hormone therapy is what I'm saying.
And study Dr. Glazier's website, hormonebalance.org. The other person I think you saw, just to mention him, I think you saw Dr. Wilgard, who is Dr. Rozier's. Dr. Rozier isn't practicing. I don't think he charged you anything, but he came in to consult on the day you came in. I think that's what happened. So that was very kind of him.
Yes.
All right. Any other interesting things we should add, or any other last comments?
I'm looking forward to my scans in a couple of weeks to find out if there's any change, if any more shrinkage, any more or less, less cancer. That's what I don't know yet. So
The best indication of how you're doing is how you feel, and I hope you feel
yes,
great.
I do. That's what Dr. Glazer said too.
Okay. Well, I really appreciate your time today, and we'll catch up on the phone, and I'll cut this recording off if you don't mind.
Okay.